Thank you, everybody, for joining for the Injury Prevention Plus Seek Wave 5 Action Period Call number 3. We appreciate all of you being here today. We also want to thank our program partner, ODH, the Violence and Injury Prevention Section, or VIPS. And this is the disclaimer from ODH. And the agenda today, welcome all of you. Thank you for joining. We have a data review with Zainab, and then we will hear from the Executive Director of the Ohio Children's Trust Fund, Nicole Silliman. And then if there is time, next steps from me. And this is the same thing that is in the chat, but if you don't mind, please share your name and your practice name, and how have you been motivating caregivers to complete the SEEK screening tool and feedback survey? Talking to some of you, this really hasn't been an issue. You haven't been experiencing too much pushback, but I am just curious to what motivational vignette you are sharing with your patients and families. Okay, Zainab, I can stop sharing.
Thanks, Brooke. I'm going to put this in like slideshow mode first before I share.
Okay.
My computer's being a little bit slow today.
Okay.
Okay, I'm just going to share because can you see my screen?
Yes.
Okay, for some reason it's not opening like the slideshow, and now it's going to open on the next screen. Anyway,
Okay.
can you see now the slideshow?
No, it looks the same as it did. I don't know if it would get bigger if you close the format background column on the right. I don't know if that's helpful.
Okay. Okay, I apologize. Okay, so like Brooke said, this is Seek Wave 5. Thanks to everyone for being here. Today I'll be presenting to you some aggregate level data, and I hope that you'll find it beneficial. I'm aiming to send Brooke individual level data by the end of the week. So hopefully by the beginning of next week or by the end of this week, you'll receive that data. So it'll be data looking like this, but it'll be specific to your practice. So as you know, we collect data for 5 major subtopics: social needs, family needs, home safety, car seat safety, and safe sleep, with safe sleep only being asked for infants birth to 12 months. And we have 2 parts really to our data collection. We have whether or not they were screened and whether or not they were counseled if they indicated a need for counseling. In terms of like the baseline data that you can see here, it was a little bit more, I guess, difficult with our data collection tool to kind of really be accurate in terms of what was going on at your practice prior to using our data collection tool. But if anything doesn't look right in terms of your individual data, please let Brooke know and she'll let me know, or you can let me know directly, whatever works best. But again, back to this. So in terms of social needs, a lot of practices already had some sort of questions in place or some sort of ask in place for their patients in terms of social needs that the family might have had issues with. So social needs are like include questions about whether or not the primary caregiver is looking for a job, if they're having difficulty looking for a job, if they're questions like that. So in terms of baseline and continuing to QI, in QI, 100% of your patients were screened, or of the patients that we received screening tools for, those individuals answered all the questions that were on the survey. Any patient that indicated a need, any patient that said, oh yeah, I do need help finding a job, they received either resources or some sort of discussion from the provider. And we saw that both in December and January. In terms of family needs, these questions include things like whether or not the primary caregiver is struggling to take care of the child, um, if the primary caregiver or the mom is suffering from depression or needs someone to talk to or anything like that. Again, 100 or all the screening tools that we received had all the family needs questions answered by all the patients. In terms of counseling in December, we did pretty well. 100% again for both age groups were counseled on any question they indicated a need for. And again, here counseling can be either receiving um, receiving any handouts or material that can help them, or having a verbal discussion with the provider. We did see a little bit of a dip here in for the birth to 12 month age group in January, but that's still a 94%, still going great. Um, in terms of home safety, usually from previous waves and from experience, um, uh, this umbrella topic is a little bit more has more needs, so it has a lot more questions. So questions like whether or not you need the number for poison control, whether or not you have a CPR certification, if all the furniture is like screwed into the walls, especially like the drawers that can tip over. So all those kinds of questions that ask about whether the home is safe for their children. Those usually we find a lot of need for discussion or need for counseling. But again, 100% of the individuals were asked all the questions. In terms of whether or not they were counseled, again, we're seeing very great rates. Please, even if I say that there's a little bit of a dip or anything like that, these numbers are still very great. So even if we stay here, that would be awesome. If we get to 100, that would be very wonderful. But um, just in general, everyone is still doing really great. Um, but yeah, as you can see here, for both age groups, we're hovering at about 95 to 100% for the QI months, or December and January, for our data collection. Safety, it looks like a lot of the practices, the majority of the practices had some sort of counseling in place or some sort of discussion in place already for the families. You were already asking them whether or not they had installed their car seat safely, or if they needed any sort of help with that. So that was great. We're still seeing great numbers in baseline. We saw some great numbers, but we're also seeing great numbers in December and January. In terms of counseling, again, we are about 87% um, and 95% in QI in terms of counseling. So whether or not they need resources, whether or not they need someone to check if it's installed properly, although most of those questions um, or most of those needs are being addressed. Again, like I said, safe sleep was uh, only asked for the older age group. Um, we are seeing, again, we saw a lot of we saw a lot of birth to 12 months patients already have some sort of question being asked prior or in baseline, but we didn't really see a lot of counseling there. Um, but as I said, like in January, in December and January, we are seeing very high numbers, 100% and 94%. So we're hovering, very high percentiles here. In this way, we also added an additional section to the screening tool to ask whether or not these patients that are receiving resources from you, that are receiving discussions from you, are willing to change, have some sort of intention to change. Um, and these next two slides will kind of give you some sort of idea of what your patients are thinking. So anytime that they indicated a need, they were asked these questions. So these are not specific to any subtopic, these are just generalized. So in terms of their likelihood of making a change, um, more than 90% indicated that they plan to make a change or that they're willing to make a change. And only about less than 10%, about 8 or 7% indicated that they do not plan to make a change. And if we want to look at this a little bit deeper, um, in terms of like a Likert scale, ready to make change, seriously considering to make a change, thinking about changing, or no thought of changing. Let me add some data labels here so it's better for us. Um, about 70% were ready to make a change. So with the resources that you provided, they were ready to make some sort of change, whether it was apply for jobs, whether it is whether it was looking into how to get CPR certified, or whether into looking into resources that can better equip them to have some sort of CPR knowledge in case something happens to their child while they're eating at home. Um, 25 or a little bit less than 25% were seriously considering making a change. About 8% were thinking about changing, and only 1% had no thought of changing. So even after receiving resources, even after receiving a discussion from the provider, they just didn't have that will to change, or they just didn't. It just wasn't a thought for them to make that change. So these are two new slides that kind of give you a feel for how your patients are feeling, what they're thinking about, how beneficial these discussions are. We can go a little bit more into detail with these questions if individual practices are interested, but this is kind of what the data is telling us now. I know, Brooke, this is the first time you're seeing this too, but I was impressed by the willingness of the patients to change. I'm hoping that the resources that we're providing are kind of pushing them. Sometimes it's not as difficult as they think, and just having those resources on hand can really make it a lot easier for them or make it a lot easier to push them to kind of make simple changes that can have very large effects later. But yeah, uh, Brooke, I can hand it back over to you if no one has questions. If anyone does have questions, please put them in the chat, or um, like I said, you'll get your individual level data or practice level data hopefully by the end of this week, by the beginning of next week. I know that we're having a long weekend, or some of us are. So just please, look for that. If anything looks alarming or anything doesn't look right, please let us know again. But if no one has any questions, I can hand it back over to Brooke.
Zainab, thank you. Yeah, the caregiver feedback results are very promising. And I don't know if we went in with something in mind, a hypothesis, if you will, but it's very encouraging to see those numbers. In the chat, most parents are very happy to help and learn. I have not had any pushback. And you received your items from Amazon. Good. Okay. We will also touch on that later. Thank you for confirming. Like Zainab said, you will get a copy of your individual data, and we can talk about that at any time. Thanks, Zainab. Okay. Hearing no questions for Zainab at this time. Nicole, I have your slides.
Great, thank you. And good afternoon, everyone. I'm Nicole Silliman, Executive Director of the Ohio Children's Trust Fund. Go to the next slide. We are the state's, we're dedicated exclusively for the state for child abuse and neglect prevention, and specifically primary and secondary prevention. So working with families before they come to the attention of the children's services system. Our mission is to prevent child abuse and neglect through investing in strong communities, healthy families, and safe children. Each year, we're designated by Ohio's governor as the federal community-based child abuse prevention state lead. And we also hold the state chapter for Prevent Child Abuse America, which is the national nonprofit for child abuse prevention. Next slide. We are one of Ohio's boards and commissions, and so we are a quasi-governmental agency. We're housed within the Ohio Department of Children and Youth, which is the new state agency for Ohio, and DCY serves as our administrative agent. But we also report to a 15-member board. And so we have 4 members of the General Assembly, 2 from the House, 2 from the Senate, 3 agency directors from Department of Children and Youth, Health and Mental Health and Addiction Services, and then 8 public members who are appointed by the governor. Next slide. And this is just a screen grab of our board at this time. You can go to the next slide. And so really, a lot of times, we get asked, well, how do you prevent child abuse? And what exactly does this mean when we're talking about primary and secondary prevention? And so we've been using this graphic lately to kind of talk partners through this. And so when we're thinking about our primary prevention approaches, which I'm sure you all are aware of as well, is we're really trying to provide a universal approach to as many families as possible before they ever fall into the river, as this graphic details. And then when we're talking about secondary prevention, those are those more targeted responses to our at-risk populations, where we're still trying to kind of pull them back up on the bridge and get them out of the water, if we're thinking through this metaphor, before abuse and neglect occurs. And then tertiary prevention is where you see our children's services system depicted, which is when we're trying to prevent the recurrence of maltreatment once it's already occurred. Next slide. And so our entire work, when we think about what we do, is really grounded in strengthening families' protective factors and trying to build buffers and increase their protective factors when we know they have multiple risk factors at play. We know that we can't always address some of the risk factors for families. And so what we try to do is build up as many protective factors as possible, which we know can build that buffer of all of those risk factors. Next slide. And our approach is really grounded in the Strengthening Families Protective Factors framework from the Center for the Study of Social Policy, CSSP. And we make sure when we're thinking about what programs and initiatives we want to fund and support at the trust fund, that they have direct connections to nurturing and attachment, parental resilience, social connections, all of these different protective factors that you see here, which we know have demonstrated that they, when they're present within families and in communities, are able to prevent child maltreatment. Next slide. And so we're going to talk about a couple different initiatives that are, one is universally available that we want to raise your attention to. And then we have some, the Family Success Network, that are in targeted communities within our state. But this is just an overview of the breadth of services that are currently being funded through the Ohio Children's Trust Fund. So we do have work with child advocacy centers. We do a lot of public awareness and professional education. We have a couple of different grant opportunities. And then we have our board approved initiatives where there are more specialized projects based on identified needs that our board is interested in. Next slide. And so over the past couple of years, the Children's Trust Fund, in partnership with previously the Ohio Department of Job and Family Services, and then now the Department of Children and Youth, as well as in partnership with the governor's office, we have really been trying to invest in a universal parent education program that's evidence-based, that can be accessible to all families throughout Ohio. And we landed on the Triple P Positive Parenting Program. And you can go to the next slide. And so what Triple P is a coordinated system of parent training through multiple different program levels, as well as different intensities, different dosages, really thinking through the needs of parents as they're supporting their children from prenatal and birth all the way into their teen years. And it was really designed on this public health model with the goals to promote children's healthy development, prevent children's social, emotional, and behavioral problems, prevent child maltreatment, strengthen parenting at a population level, and destigmatizing help-seeking behaviors. Next slide. And so the really big reason why Triple P really hits all of those buttons when we're looking about what to invest from a statewide standpoint is that it can have so many different variations to meet the needs of how families want to interact with an evidence-based program. It can be offered in person or online. When families are accessing the online version of it, it's 24 hours a day. It can be offered in person through a home visit and a one-on-one approach, or it can be offered in a group setting. And then it really ranges from very low touch, from brief 15 to 30-minute kind of one-on-one individualized consultations, all the way to intensive multi-week, multi-interaction program dosage if a family is having some challenges with some, either from the parent themselves having some issues, or for the child who's having some behavioral issues. Next slide. And so this is a pyramid that's just essentially showing all of the different levels of Triple P and the different ways that it can be implemented. Currently in Ohio, we are, and it's not available through all levels throughout every county in the state, but we have some variation from universal awareness all the way to more individualized interventions in existence throughout the state of Ohio, just not all of these levels throughout every county in the state. Next slide. And so what makes Triple P really beneficial for families, and they refer to it as their secret sauce, is their self-regulatory framework. And so it's really designed on helping parents understand kind of what's going on within them, within their relationships. If it's a two-parent household or co-parenting situation, are there differences in how one parent is parenting versus another? Is that causing tension between the family dynamics? Having the parents think through what the goals are for their family. And it starts with really grounding in the knowledge of what is positive parenting. How do we look at what we're doing as a parent first? And then once families have that foundational knowledge, then it helps them walk through, okay, now how do we apply this to challenging behaviors that we're seeing with our kiddos? How do we work on children's aggressive behavior or temper tantrums? How do we institute timeouts? And so it really walks parents through an understanding the dynamics that they're feeling, helping them self-regulate, and then being able to apply those practice and model that behavior with their kids. Next slide. And so about 2 years ago at this point, we made an investment to offer the Triple P online program free for any Ohio family or caregiver who was interested in taking this evidence-based program. So the online program is the self-paced version of the Level 4 Triple P. There are currently 2 programs available, one for that birth to 12-year-old, and then one for caregivers of preteens and teens. And then additionally, we have the model and some coaching services available in both English and Spanish. I think that the important thing to know about this is that the Level 4 is an 8-module online program. The teen version is 6 modules, and it follows that sequential practice that I was talking about in the previous slide about really building up parents' understanding of positive parenting practices, and then helping them think through how do you apply that to some of the child behaviors that I'm seeing within my home. Next slide. And so the Triple P online program does walk families through that sequential order that I mentioned, talking about the basic principles, encouraging those desirable behaviors that we want to see. And then it gets into that teaching new skill building behaviors, managing problems, and then helping families plan ahead. Sometimes you know that you're going to go out into a situation that can be high stress on the parent, high stress on the kids. So how do we plan for those and make sure that we have all of our different tools in our toolbox so that we can navigate if something goes wrong, so that we're not at a heightened situation during a high stress area. And then really kind of transforming that into supporting and raising, children with strong social emotional skills. A thing that's included in the online program, and this is also included if families engage in some of the in-person variations of this model, there are video clips of real families kind of walking through what does timeout look like? What does it look like when, you're trying to have dinner and your kid is not listening, throwing food, having temper tantrums, and showing you real video clips of families kind of navigating those situations. You can feel, as a parent who's gone through those, the stress that mom in that video might be feeling, and then seeing different ways of trying to institute behaviors to, kind of navigate the child behaviors as well as support the parents and making sure that they're staying calm and applying their self-regulation skills. The online module also has interactive, activities and workbooks and different things that families can set goals and develop their own plans, really kind of focusing on, what are those behaviors that they might be interested in trying to get some techniques for, as they're applying practices, how's everything going, and just really resources to help support the family as they're working through the online program. And then something that we instituted early on, but are expanding this so that we have coaches across the state, is this individualized coaching and consultation support piece. And so we know, an online program isn't for everyone. And it might be, the only option for a family in some communities to access an evidence-based program, but maybe they want to have a conversation with a trained professional to talk through some of the challenges they're having. Maybe a solution isn't quite working for them. So can they have some resources or somebody to talk to help, try something else? And so we currently are working with Nationwide Children's Hospital to provide individualized coaching. So families can receive up to 3 20 to 30 minute virtual, or they can be on the telephone. In some cases, depending on the location, they can be in person. But these consultation calls with accredited and trained PPP providers. We're in the process right now of taking the model that we've worked with Nationwide Children's Hospital on and training providers in 6 regions throughout the state of Ohio. The Trust Fund has 8, so for 6 of our regions, training multiple providers in this coaching model, so that if I'm a family in Lucas County, for instance, I can contact somebody at Harbor for support through this coaching model versus contacting somebody all the way down in Columbus at Nationwide Children's Hospital. So really trying to localize this coaching and consultation support for families who might need some help while they're working through the online program. Next slide. This is just a link to the website, and we can provide that to Brooke to send out after this, so that if you want to go to the Ohio website, you can see it there. Next slide. And so when a family registers for the PPP online program, they have immediate access to the online modules, and their access lasts for 1 year. I will say, if a family, for some reason, because life happens, something happens and they just can't complete it in the year, but they still want to have access to the program, they can just send an email to our consultants at Nationwide Children's Hospital, which are the people who continue to send those welcome followed up emails that are mentioned in the next bullet, requesting that their access be extended, and we can go ahead and do that. But so they're going to receive these welcome emails and then monthly emails from their PPP coaches, as well as just general parenting tips on a monthly basis. So we'll pick a topic for each month and then send out some resources. Just so even if maybe they're done with the online program, or maybe it wasn't for them, they're still then receiving parenting resources in connection to a trained coach on a monthly basis through this approach. Next slide. And so this is just some videos. I think it's helpful when we talk about the online program that people can see, well, what does this look like when a family is engaging in an online program? And so this is a video of how a mom is working on assertive discipline. And you can see, she's getting 3 kids bundled up, strapped into their car seats, some getting ready to go somewhere. And if anybody has had to strap your ornery kids into car seats, you can know sometimes it gets a little stressful. So again, it's trying to take those real life challenges and show how do you apply those PPP positive parenting practices to them. Next slide. And then this is just a screen grab from the online platform related to, what are different things that you might try based on what you learned in this module. This is about helping your children with independent play, and then also thinking through things if you're gonna do something together with them. So what are some ideas? So trying to think through planning for the future so that they always have, ideas and thoughts, at a later point in time that they can pull from because they've written it down, they've, applied it already as part of this online module. Next slide. And then another thing that is available on the State of Ohio PPP site is we know that not everybody, and I think I've said this about 3 or 4 times, an online program isn't for everybody. And so the state has also invested over many, many years training and accreditation for practitioners throughout Ohio to be trained in multiple of the different levels of PPP. And so providers are able to log in and then list when they have upcoming PPP in-person sessions. And so you'll see a bunch of different, level 3 discussion groups, level 4 discussion groups. And families are able to search by find a session or search providers. And then they're able to kind of type in, a lot of times it'll geo-track where the family is already, but then they can enter in their zip code or their area, and then they can find a listing of trained providers within their own communities where they could go to an in-person session. Next slide. So this is just a little bit of comparing the PPP online program. The other thing that is currently also available for the state of Ohio is for childcare professionals. There was also a pretty big investment in the Positive Early Childhood Education Program, the PEACE program, which is also supported by PPP. And really the goal of that is to train those early childcare professionals in the same approaches as what we're working to support parents in, so that all of those adults and caregivers who are interacting with our young kids are utilizing the same models and the same approaches to support positive parenting and positive behavior. So it really is just the practitioner training for early childcare settings that mirrors the same concepts that our parents are getting. But a link to the PEACE program, if you have any connections to early childcare professionals, is at the bottom of the state's PPP online website. Next slide. So something else that I just wanted to make you all aware of, and I know this isn't for all of the current counties who are participating, but we do have a couple of counties where there is an active family success network. So I wanted to talk about this today. You can go to the next slide. So a couple of years ago, the trust fund received a federal discretionary grant. And we really saw a need to have like a prevention services case management model for children outside of the children's services system. And so with this federal grant, we created the Family Success Network, and we originally piloted this in Columbiana, Mahoning, and Trumbull counties, but we have since expanded this to Cuyahoga, Hamilton, Claremont, Brown, Summit, Lucas, and Wood counties, with an additional opportunity open to also expand to Franklin and Stark counties. We're really looking at some of our counties with extremely kind of high needs areas, and then their surrounding counties as part of this catchment area. But the Family Success Network is voluntary, so it's parents who opt into participation, and it's really designed to strengthen and support families based on their unique needs. And what we're providing to families through a family coaching model is information and referrals. And so that may be things like access to a food pantry or, a homeless shelter, things like that. Parenting support, and we're doing that through Triple P as our parent education program. Basic life skills, we're doing that through a model called Transition to Independence Process Model. It was originally for children aging out of the foster care system, and it was essentially teaching foster care youth how to define goals for yourself, how to plan for the future, some of those foundational life skills that we need as we think about, what does being an adult mean? And what we know is that some of our parents don't have those skills. And so we've worked with the developer to tailor the model so that it can be universally applied to parents in general who might need some support around those basic kind of goal development, decision-making processes. We are providing financial literacy, so helping families think through what does establishing a budget look like, what does managing my expenses look like. Again, decision-making around financial resources is very critical. And then concrete supports. And so we know a lot of families who are currently accessing our programs really need some assistance financially. And so we provide them with one-time financial concrete supports. And then all of this is really around meeting families in their homes, or any other place where they feel comfortable and having this one-on-one connection with the family coach. Next slide. And so this is just a visual of basically what I talked through on the previous slide, but it's essentially showing, how families are coming into the program through. So, through those community partner referrals, some sort of internal referrals. We have multiple of our Family Success Network sites running through the county's 211. And so that's how we're receiving those internal referrals. And then we're actually seeing over 30% of our families who are now self-referring into the program through word of mouth, identifying that this is a need for their family. Next slide. And so what it looks like when a family starts engaging with the Family Success Network, it starts with a family coach really working with that family on identifying their need. So this whole program, though it has multiple different evidence-based models embedded in it, it's really not prescribed in a traditional evidence-based way. It's about having a family identifying their need. Our family coaches are then trained also in motivational interviewing. And so they kind of pick up on different things that the family may identify, and then they'll apply their knowledge related to those evidence-based practices. But a family doesn't necessarily feel like they engaged in evidence-based model to fidelity, even though those practices were applied to that family. And so then as family success planning begins, like I said, the family then is engaged with all of those different practices. And then typically families stay in the program between 3 to 6 months, but we've seen some families staying somewhere between 6 to 9 months with an average of involvement with their family coaches about 2 times per month. Next slide. So this is just a visual of where Family Success Network is currently in existence. But like I said, we have an opportunity out right now to expand to Franklin and Stark County. And so we hope to continue kind of integrating this program across the state to meet the needs of our families. Next slide. This is a resource that is also available on our website. You can go to FamilySuccessNetwork.com and it'll reroute to our website, but then you can see a little more information about the program as well as the different sites that are currently in existence. Next slide. And then I have to put a plug in for the Children's Trust Fund website as well. So you can visit us at octf.ohio.gov if you would like to find out more about us and kind of get in contact or learn more about what we do. We fund a ton of different programs, as I mentioned previously, but we also have a bunch of resources on our website for both professionals and parents alike. And so, you know, if you have time, this definitely is a great resource bank to kind of help both professionals as well as parents. Next slide. So I know, I think we do have a little bit of time. So if folks have any questions, I'm happy to answer any of those.
Nicole, thank you. While you're thinking of your questions, just a reminder for the group that you received Triple P documentation in your first box of materials for the program that had your iPads in it. If you want to review those and ask questions as they come up, that is fine. If you need more documentation, I can also send that to you. But any questions for Nicole on this good information? Does Ohio Rise give out Triple P information too?
That is a good question. I don't know the answer to that, but we can explore. I know we've been having a lot of conversations and a lot of meetings with different state agency partners and programs. And so we can find out. I don't believe that they are specifically giving out information on Triple P, but we'll follow up.
Nicole, these programs seem to be the most robust they've ever been, and they continue to grow year after year. Is that correct?
That is correct. Yes. There's a lot of, I would say, support around expanding these programs and these models, and then really having a statewide approach so that families, you know, regardless of what county they're in the state, are getting access to the same kind of high quality evidence-based or evidence-informed practices. So really trying to equalize the services that we have so that every family across the state is able to access these programs.
Are pediatric primary care providers able to engage in different ways? They can get resources and refer their families, but can they also be an educator around this information?
Yes, and I think so with regard to Triple P, are you asking if you're able to become an accredited Triple P provider?
Yes.
Yes, that is true. So we are about to kick off another training series. And so if you're interested in being trained, you can send me an email and we can make sure that you're on our list. I will say we offer trainings on an annual basis. And so if it doesn't work out this time, we keep our waiting list still intact, and we would contact you in the future as well.
That's good to know. Another question, how do you keep families engaged in the program throughout the year?
So for the Triple P program in particular, that's really where that coach consultant comes into play. They are frequently reaching out to the families, you know, through different emails. We're about to get texting capabilities involved. And then through our Family Success Network, that whole model is built around relationship building with the family, identifying their needs, and then that connection to that family coach. And so that family coach is setting up, every other week, home visits with the family, to, keep them engaged in the program. Obviously, families will drop off. But what we are seeing right now is that relationship, and we're measuring the quality of the relationship between families and that family coach. A stronger connection in that relationship is now showing more positive outcomes when we look at our pre and post test. And so we're really seeing that relationship with our family coach as the driver for change. And so anything that we can do to support that. We also do different outreach events within the communities, different backpack, shoes for schools. So we try to do different things to think about the different needs that families may be having, which will also help retain them into the program.
Great. I couldn't help but think the trust with the relationship with the coach or their primary care provider in this case needs to be built for patients and families to stay engaged in whatever they are working on, right?
Exactly.
Any other questions for Nicole? If you think of anything later, I am happy to send her any questions that you think of too.
Thank you so much for the time today, and definitely, let us know if we can partner in any way. And if you want training, feel free to send me an email and we'll make sure that you're on our list.
Thank you, Nicole. Thanks so much. Good to see you again.
You too. Bye.
Bye-bye. Okay. Being mindful of time, next steps for the program. Again, I've heard from some of you around some of these things, but also wanted to provide some clarification. So you should have received your first shipment of tangible resources directly from Amazon. Those were part of the SEEK program sent by us through Amazon. So it caught some people off guard, but you received cabinet locks and furniture anchors. And those are part of this program, and you can feel free to use them with your families as appropriate. Bigger tangible resources have been shipped here, and we are sorting those out. So you will be getting a bigger box in the mail eventually. If you aren't getting the paperwork from me or the Amazon shipment, we'll just want to make sure that we have the correct address for you so we can ship the bigger tangible resources to you directly and make sure you get them. Please continue to use the SEEK screening tool and caregiver feedback survey. As you saw today in the aggregate data, you're doing a very good job of this. I'm glad that your families are motivated to complete this and to have the good conversations with you and to move forward in learning and resource share across our topics and subtopics. So thank you for that. For those of you who haven't submitted your Plan, Do, Study, Act worksheet, if you could please do so as soon as you can. If you have questions around the PDSA, I'm happy to walk you through and send you some more resources on that process. We're just looking for what you have done in your program implementation and putting those on a worksheet to kind of write those out and going forward, looking at what you have done and then seeing what would be good for your next PDSA worksheet, kind of moving through the program. And then if I haven't talked to you at the practice coaching call level, kind of the individual level, see me for scheduling for that. And then the next action period call, the fourth one, will be Wednesday, March 13th at noon. Just like this one, all calls will be recorded for viewing on demand and for sharing. I will pause here and see if there are any additional questions from the group. Okay, hearing none, please expect your Friday check-in email for me to be sent tomorrow. And then your individual data, I'm planning to do that next week. So thank you everybody for joining. If you have any questions, please email me, don't hesitate. And I appreciate all of you joining. Have a good week. Thank you.